One of the skills you may be asked to perform when you take your state exam is to empty the contents of client's urinary drainage bag and measure and record the urine output on an intake and output INO form. The role of the resident client will be played by either a person or a mannequin. You will be asked to empty the resident's urinary drainage bag into a graduate container and to measure the amount of urine. An intake and output INO form will be provided to record your measurement. The output should be recorded as urine and the correct time recorded for the measurement. The checkpoints the state evaluator will use to evaluate your performance are listed at the end of this video demonstration. Greet the client, address them by name, and introduce yourself. Explain the procedure by speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible, and ask client about personal preferences. Provide privacy with a curtain, screen, or door. Put on clean gloves before handling the urine drainage bag, graduate container, and bedpan if used. Set graduate or bedpan on a barrier placed on the floor and empty the full contents of the drainage bag into the graduate container or bedpan, keeping urinary drainage bag positioned lower than the client's bladder throughout care. If urine poured into graduate from a bedpan, complete task over toilet, pouring the full amount of urine into the graduate container without spilling or splashing urine outside of container. Set graduate on flat surface protected with barrier to read obtaining measurement by reading graduate at eye level. After measuring urine, empty contents of graduate container into toilet. Rinse and dry graduate container and bedpan if used, pouring rinse water into toilet. Place any soiled linens in hamper, graduate container, and bedpan if used into storage area and trash in trash can. After rinsing equipment and before recording output, remove and dispose of gloves without contaminating self into waste container and wash hands. Record contents of graduate container within plus or minus 50 milliliters of evaluator's reading. Make sure the signaling device is within reach and bed is in low position. Wash your hands before performing your next skill or at the end of your last skill. Skill checkpoints. Does the candidate. Greet resident, address by name, and introduce self. Provide explanations to resident about care before beginning and during care. Wear gloves while handling the urinary drainage bag, graduate, and bedpan if used, and remove gloves before documenting INO. Set graduate or bedpan on barrier placed on floor and empty full contents of drainage bag into graduate or bedpan. Empty contents of urinary drainage bag without contaminating drainage tube and close and protect drain after emptying drainage bag. Set graduate on flat surface protected with a barrier to read, obtaining measurement by reading graduate at eye level, and if urine poured into graduate from a bedpan, complete task over toilet, pouring the full amount of urine into the graduate. Empty urine in graduate into toilet after measuring. Rinse in dry container, pouring rinse water into toilet. Record output with clean hands. Record output within plus or minus 50 milliliters of nurse's measurement. Record output as urine and indicate the correct time on an I&O form. Leave bag hanging from bed frame, not side rail, and drainage bag and tubing off, not touching the floor. Keep urinary drainage bag positioned lower than bladder throughout care. Complete skill having stored equipment, placing soiled linens in hamper, and disposing of trash. Ask resident about preferences during care. Use standard precautions and infection control measures when providing care. Ask resident about comfort or needs during care or before care completed. Promote residents' rights during care. Promote resident safety during care.